We're speaking with Dr Chris Lease from SA Health. How are you, Doctor?
I'm very well, thank you.
We wanted to check in with you about this Japanese encephalitis outbreak. Since the start of the month, really, there'd been reports it's in pigs and there was risks for horses, but now we've got some human transmission concerns.
That's right. So we announced earlier in the week 4 cases that have been confirmed here in South Australia, 3 of which are actually looking like they've been locally acquired, one of which has travelled interstate. So really, we're, I guess, increasing warnings to people to be aware of mosquito bites and prevent them as much as they can.
Now, Japanese encephalitis, from what we're hearing, has not really been picked up in this fashion in humans before in the southern part of Australia, but it has been occurred in the northern parts?
That's exactly right. So the reason why there's obviously a lot of attention going into this is probably the first time it's been seen this far south. We've detected in sort of Queensland, close to the border with New South Wales, and New South Wales, Victoria, and of course here in South Australia. So it is the first time we've seen it come down this far south, and that's why there's a lot of work going on both here locally but also at a national level to try and get to the bottom of it and also protect people because it's thankfully a rare disease, but the outcomes can be really quite dire. So we really want people to be aware and take some simple precautions to protect themselves from it.
Well, I guess we shouldn't assume people understand the risks of encephalitis, and also what are the age risk categories for humans when it comes to encephalitis?
So it really is a risk for all of us, but particularly for children, of course, we want to make sure that they're looked after. Really, a lot of the cases that we've seen are in people over 50, but that's not to say that people, outside of that age group are not at risk. And again, because the mosquito is the key transmission source, really, it's for the whole family if you're out and about to just be aware, and also to take some of those mosquito bite precautions such as wearing repellent and long loose-fitting, light-coloured clothing, particularly in sort of dawn and dusk when the mosquitoes are more active, and hopefully that'll go a long way to protecting people from this disease.
You mentioned loose-fitting clothing. I read somewhere you can even be bitten through jeans. Is that right?
Yes. So it's something that people aren't really aware of, that mosquitoes can actually bite through some clothing, and of course the closer or the tighter that clothing is, the better chance for them to do that. So really we want people to be aware that looser clothing is a better way to go because it'll confer better protection.
Well, this JEV, the shorthand for Japanese encephalitis, was initially picked up in pigs, and I think the initial transmissions from pigs to mosquitoes to humans was in piggery contexts, but is it now a concern that it's generally out there in the mosquito population and could hit anyone?
Well, we're looking at that closely. We've got a mosquito monitoring program that runs right across the mosquito season, which used to be basically summer, but it does extend out a little bit, and it's really dependent on climatic factors such as, whether there's rainfall and warmer weather, which really, the water, of course, is a breeding site, and the warmer weather sort of really bumps along the breeding cycles. So it's one thing that we're keeping an eye out for. We do a lot of surveillance around mosquito-borne diseases in humans as well as in animals. With this particular situation we've got at the moment, we've actually increased the intensity of that monitoring just so we can look to pick up anything that might be there. We did have a detection of a piggery, which was announced on Friday last week, but we haven't seen anything in our mosquitoes just yet, and in our sentinel chicken flocks, which are the chickens that we bleed to see if there is some transmission going on. We haven't picked it up in there either. So it's really just trying to see, if we can pick up any warning signals in our systems. But of course, when we get human case, we need to put the word out to the community as well around those. Again, just to make people aware so they can take those precautions that they need to.
Now, I think the federal government has now spent somewhere around $60 million it announced in the last 24 hours for vaccines for this virus. There are a couple of ways of getting vaccinated, but probably more so if you're working in a piggery than the general population, or is it people that are at high risk might want one as well?
So, we're really targeting at the moment the people who are most at risk. So if there had been a detection at a particular piggery, for example, the people who work there, also the people who are involved in our monitoring programs, they're really sort of the front line, if you like. Because Japanese encephalitis vaccine is relatively rare in terms of having to use it. It's really only been given to travellers previously or people who work in laboratories with the virus itself. There's not a large supply, but those supplies are starting to increase, and there's a lot of work going into, strategies around vaccination programs. But at this stage, it's really those higher risk people that we're focused on for vaccine at the moment.
Now, just lastly, it's called Japanese encephalitis. Is it because it was initially first detected in Japan? Is it a common encephalitis in that part of the world?
So it is common in or endemic in a range of places in Asia, and that's really why it's been more familiar to us as a disease in travellers. Some people might have already received the Japanese encephalitis vaccine because they had travelled to endemic areas, and that's sort of right through up to sort of quite far North Asia, but right through Southeast Asia and into India, and that's people staying there for longer periods were often given the vaccine. It is endemic to those areas. Whether it becomes endemic here is a bit of a question. We're hoping as the weather tends to cool down over winter and, we mozzies sort of drop away a little bit, that we won't see it bounce back and return sort of later this year. But that's something we'll continue to monitor quite closely because it is quite an unusual disease to come this far south.
Oh, sorry, I forgot to ask as well. My wife bought some bacon for a weekend breakfast. It's safe to eat bacon, though. That's my understanding. Is that correct?
Yeah, absolutely. So the key transmission route that we're worried about is the mosquito one. You can't get it from eating pork, so you're fine to eat your bacon.
All right, thank you, Dr. Chris Lease. Thanks very much from SA Health for sharing that important health information for us.
No problem at all.